Hi everyone, I hope all of you are doing good. Today we are going to continue with the part 6 of Human Health and Diseases chapter, and this is a lecture video. And today in this part 6 we're going to deal with AIDS. Okay, what is the full form of AIDS? It stands for Acquired Immunodeficiency Syndrome, right? And what causes this AIDS? It is caused by HIV, human immunodeficiency virus. So before we go into this part, I would like to add few points from the aspect of need. So as I already mentioned in the other parts, this particular chapter is quite important because you at least expect 3 to 4 or sometimes even it is 4 to 5 questions from this chapter, and mostly when it comes to the diagnostic questions, where you have questions on diagnostic measures about the disease, you can expect at least one question from AIDS. Okay, this is a very easy part and a very a relevant thing, a very common thing to be discussed today. So please be sure about the diagnostic measures that they take for AIDS, and the structure of HIV is also important when it comes to this particular part. So let's begin here. Okay, as I already said, the word AIDS stands for Acquired Immunodeficiency Syndrome. This is a secondary immunodeficiency condition in which one person experiences infections due to the progressive destruction of the immune system cells by the virus called as human immunodeficiency virus. Okay, I would like to add some points here. So when we talk about HIV, okay, so we all know the emergence and the pandemic spread of this particular AIDS called Acquired Immunodeficiency Syndrome have posed a great challenge to public health in modern times. So after the sudden appearance of syphilis in Europe 500 years ago, rarely has a new disease had a great impact on medicine, science and society, caused by much panic among the public and the government. So after syphilis, if you see, the most dreadful disease, they consider it as AIDS. Okay, so I would like to add some more points here. So the first indication of this new syndrome came in the summer in the year 1981. Okay, so the first report of AIDS came in the year 1981, and the reports were from New York. Okay, so these are the points that I would like to add here. And to talk about this particular HIV virus, this belongs to the family of retrovirus. So here it is given here. HIV is a member of the group called as retrovirus, which have an envelope enclosing the RNA genome, which means it is an RNA virus. And when it comes to viruses, they can only have either of the genetic material but never both. Either it should have DNA or either it should have RNA, but never both. So let's talk few points about HIV. HIV, the etiological agent of AIDS, belongs to the family Retroviridae. Okay, and the subgroup, you should be aware about this subgroup also. So the subgroup for this HIV belongs to lentivirus. Okay, the lentivirus subgroup includes the causative agents of the slow virus diseases. Besides, HIV is related to animal immunodeficiency viruses. So initially it started from rhesus monkey actually. That's how it got into humans. So humans did not contract this disease directly. So let's move on to the next part here. So we're talking about the transmission of the HIV infection here. So how does this virus get transmitted from one person to another? So the transmission of the HIV infection generally occurs by sexual contact with the infected person. So that is why it is often called as sexually transmitted disease. Transfusion of contaminated blood and blood products. if the person who's willing to donate has HIV virus in the blood, and if they unnotice it, or if they don't do a proper monitor, and if they happen to donate blood, and if that blood is given to somebody else who is healthy, they also get the disease. Then by sharing infected needles, as in case of intravenous drug abusers, especially the one who are addicted to drugs, they will not use proper habits, hygienic habits. So intravenous drug abusers are also infected from infected mother to the child through her placenta. But now you have medications to prevent that entry. But initially in history, if you search, there was no medications to stop the infection from the mother entering into the fetus. But now you have medications. If the mother has, doesn't mean the fetus will also have HIV. And next is, it does not spread by mere touch or physical contact. Very important to be noted here. This disease is not contagious as you think. By sitting next to the person who's affected with HIV, or if someone coughs or sneezes, touching their materials, it's not going to transmit the disease. Okay? So now coming to the important part, we're going to discuss the HIV structure. That is the human immunodeficiency virus structure. So this HIV, as I already mentioned, it is an enveloped virus. Right? It is an enveloped virus, and it is about 90 to 120 nanometer in size. And this is an RNA virus. The nucleocapsid has an outer icosahedral shell and an inner cone-shaped core enclosing the ribonucleoproteins. So when I say RNA, it has ribonucleoproteins. The genome is diploid, composed of two identical single-stranded positive sense RNA copies. In association with viral RNA, it has a special enzyme which makes it more special and resistant and help in the survival of this particular virus. Any idea what that enzyme is? It is called as reverse transcriptase. This question can be expected from NEET side, so kindly make a note of it. The enzyme name is reverse transcriptase. So this enzyme is a characteristic feature of this retrovirus family, and especially for HIV, they say. When the virus infects the cell, the viral RNA is transcribed by the enzyme first. It will get first into a single-stranded DNA and then into a double-stranded DNA, which is integrated into the host cell chromosome. So this is the important mechanism to be noted here. Okay, so that conversion, right? So basically it was RNA, it is getting converted into DNA. That conversion is happening with the help of this particular enzyme. Very important step. Kindly make a note of it. I'm telling you again and again. It consists of an inner core of single-stranded RNA covered by protein coat, and this is an RNA, so it will have ribonucleoproteins. So the envelope is composed of lipid bilayer that is penetrated by glycoproteins, which surrounds the HIV capsid. So here you have the clear structure of the HIV, right? Yeah. So these are the glycoproteins. This is a lipid bilayer. You have a protein coat, you have the enzyme, you have RNA, the genetic material. The size of it is 100 to 140 nanometer, or it is 90 to 120 nanometer, and it has an envelope too, right? So another thing to be added here is, during viral replication, when the naked virus buds out through the host cell surface membrane, it acquires a lipoprotein envelope which consists of lipid derived from the host cell membrane and glycoproteins which are virus coded. The major virus coded envelope proteins are the projecting knob-like spikes on the surface. So you have it here, right? The glycoproteins that you see here are the knobs. They are knob-like structures, right? They are knob-like spikes on the surface, and they help in anchoring the transmembrane pedicels. The spikes constitute the major surface component of the virus, and this will bind to exclusively CD4 receptors on susceptible host cells. Transmembrane pedicels causes cell fusion to happen. I think so far whatever is explained about the structure and the mechanism is understood. Moving on to the next one. So we're talking about the HIV infection in this particular page. So here they are saying that outside a living host cell, a virus is unable to replicate. If you had clearly watched my videos, you would have understood what I meant here. So as I already said, the main difference between bacteria and virus is that bacteria can survive without a host. It can survive without a host. But a virus, if you say, it exclusively requires a host, irrespective of what the host is. It can be a plant, it can be an animal, it can be another microorganism too, it can be humans as well. So they need a host, a living host cell, that too a living host cell for it to replicate. So outside the living host cell, the virus will be unable to replicate. However, when the virus infects and enters the host cell, it will use the host cell's enzymes and ribosomes to make thousands of copies of the virus. So this is how they multiply in number. So the new HIV copies bud from the cell's plasma membrane and they circulate in the blood to infect the other cells. So what are they doing? They are multiplying and they are infecting the other cells as well. So HIV enters into the helper T lymphocytes, which are your major component of your human immune system. They call it as T helper cells simply. And as I already said, when we talked about immunity, we have B lymphocytes and T lymphocytes. T lymphocytes play a major role in immunity part and especially T helper cells. So if you clearly note here, the primary pathogenic mechanism of HIV infection is to damage the CD4 T lymphocyte. The T4 cells decrease in number. So what happens here? Once it starts to replicate and produce, the T lymphocytes, the helper T cells will slowly decrease in number. Okay, so the mechanism of HIV, if you clearly watch, right away it will not give you any symptoms and signs. The main work, the initial work of HIV is to infect, make the host weak. If you clearly see here, it is understood. It will first or initially make the host immune system to weaken, and then only it starts showing signs and symptoms. So this actually, as I mentioned, it doesn't do anything, purposely. The HIV requires a host for it to survive, and their survival is only on the basis of deteriorating the host. It obviously starts using any host it acquires to, it uses its mechanism because it doesn't have any source. It can only survive in a living cell, right? Viral infections can suppress the function of the infected cells with the outcasing structural damage. So what happens here? The infected T4 cells do not appear to release normal amounts of interleukin 2 gamma interferon and other lymphokines. Interferons are exclusively released for viral infections. So when these productions are suppressed, the virus will gain more power. This has been to be a marked damping effect, which will it will have a great impact on the cell-mediated immune response. Due to the decrease in the number of the T helper lymphocytes, the person starts suffering from infections. So it's suppressing the number first. It's weakening the immune response of the person, and then only starts showing the signs and symptoms. That's because obviously when the person's immune system is suppressed, automatically it becomes an opportunity for all the other infections that are prevailing outside. It gains entry into the person. That is the main reason why HIV patient has complicated. They have multiple symptoms. It's not that associated only with HIV. The patient who has HIV can also have TB. So all these are opportunistic infections which gain entry because of the suppression of the immune response. So look at the symptoms and diagnosis of HIV infection. The symptoms include soon after being infected with HIV, most people experience a brief flu-like influence. So this is the first illness that they feel. They get fever, they get fatigue, rashes, headache, joint pain, sore throat, swollen lymph nodes. And about 50% of infected people also experience night sweats. And the diagnostic measure for AIDS or HIV is ELISA. The full form is given here, enzyme-linked immunosorbent assay. So to talk about ELISA, this is a direct solid phase antiglobulin method which is commonly used. The antigen is obtained from the HIV grown in continuous T lymphocyte cell line or by recombinant technique and should represent all groups and subtypes of HIV 1 and 2. The antigen coated on microtiter wells or other suitable solid surface. The test serum will be added here, and if the antibody is present, it will bind to the antigen. After washing away the unbound serum, that is the anti-human immunoglobulin linked to the suitable enzyme, is added, followed by a color-forming substrate. If the test serum contains anti-HIV antibody, it will photometrically becomes where the color would be visible or formed, which can be read by a special ELISA readers. ELISA is a simple and relatively inexpensive, but sometimes there are chances to given false positive reactions are common in this test. But till now they have also made some modifications to this ELISA test, because this is highly kind of specific test that they go for detecting AIDS or HIV. So there are some modifications made here which have enhanced this method to an advanced level. Fine. So now moving on to the treatment of HIV infection. So here we're going to see the treatment. Two categories of drugs have been proved successful in extending the life of many HIV infected people. So this is a syndrome. So the person is naturally going to die because of the multiple disorders and symptoms that the person is experiencing. The body will only work on or will only function if the immune system is at a right level. So when a person is affected with HIV, depending upon the virulence of the microorganism, that is virulence factor, they call this as virulence. Virulence means the capacity or the number of virus that the person has. Now, for example, if a person has contracted the disease through sexual contact, the virulence of the disease will be more because the entry of the organisms are at higher rate. Now imagine if it is going to be a simple prick, a needle prick, an infected needle prick, the virulence will be less. So depending on the stage of the person, the treatments are carried out to prolong the life of the people affected with HIV. So here you have reverse transcriptase inhibitors. What do? They interfere with the action of the reverse transcriptase enzyme. As I already mentioned, this is a characteristic feature of Retroviridae family, and this enzyme is responsible for all that happenings in your body, because this HIV enters as RNA, but it gets converted into DNA, thereby making the host understand or giving a misunderstanding that this DNA also belongs to self, so that the body will not attack it. See how much it works on it. So we give them reverse transcriptase inhibitors, which will interfere with the action of the reverse transcriptase enzyme. So the name is Trizivir. Okay, it is called as Trizivir. It's used for the treatment of HIV infection, which combines 3 reverse transcriptase inhibitors. So you have 3 here: zidovudin, didnazoin, then you also have stavudin in one pill. Then we have protease inhibitors. They interfere with the action of protease, a viral enzyme that cuts protein into pieces to assemble the protein coat of a newly produced HIV particle. So you have a number of enzymes that are added to this pill. So what are the 4 things that are given here? Nelfinavir, Scawinavir, Ritonavir, and Indinavir. So with this we complete AIDS. So let me give you a small summary of this. So as you all know, AIDS stands for acquired immunodeficiency syndrome, and this is caused by HIV virus, and this has a complex structure, and this is basically an RNA virus which belongs to the family of Retroviridae, and it also belongs to a subgroup called as lentivirus. This virus, though being entered as RNA virus, the reverse transcriptase enzyme, which is a characteristic feature of this particular family, helps in the conversion of the RNA virus into a single-stranded and then gets converted into a double-stranded DNA, thereby making the host, cannot recognize. It gives you a wrong recognition, showing that this DNA is not foreign. Therefore, the host cell will fail to identify this is a foreign material. Thereby, what does it do? It goes and adheres itself to the immune part, the immune places of your body. Especially, it goes and settles in the T4 helper cells. Once the T4 cells or the T helper cells numbers start to decrease, the symptoms and signs are clearly visible. That is because of the immunosuppression of the host. So it paves a way for the entry of other microorganisms. It's not just HIV who plays a role now. It also paves a way for the other microorganisms. The person might subject to fungal infections, bacterial infections. So the main reason of this particular virus is, the first thing it does is it will weaken the immune system of the host, and then only it starts the multiplication work. So this HIV can be prevented by proper hygienic methods, like we should not use any uninfected needles, or we can prevent ourselves from having proper hygiene. And this disease does not spread by physical contact, does not spread by touching or hugging or something of that sort. So this disease, if you see, can be prevented by avoid using contaminated needles which can transmit the infections, and you can also prevent yourself from using unsterile syringes and needles which are not qualified by your health workers. And another best method is to check your sexual transmission. And this transmission of the infection from the mother to baby is also another medium of how the virus gains entry. So these are the preventive measures that you can take from avoiding such dreadful infections. And as I already said, viruses require a living cell to survive. Therefore, viruses doesn't have any advantages on their part, because they can only deteriorate a host cell and grow. Thank you for watching my video. Hope to meet you in the next part with another set of explanation. Thank you.